My name is Taya and I am 31 weeks pregnant. We knew that because of my health conditions, it'd be a roller coaster to go through and lots of appointments, lots of doctors. I have Alagille syndrome. It's a very rare condition. It's a possibility that the baby can have it, but we won't know until she's born for sure. There was recently some cases known that there's a ductal closure that happens early on through pregnancy, and if it happens, it's not caught right away, which causes the death of the baby due to that ductal closure. So they want me to see somebody to be able to figure out if the baby would have that, and through then they did find a little bit of a narrowing in the ductal. So they want to check it every 2 weeks to make sure that it doesn't close anymore. To have this equipment to be able to check and see what's going on makes me feel more comfortable, and just I'm not as worried.
I'm Dr. McBrien. I'm a fetal and neonatal cardiologist at the Stollery, and I'm director of the fetal and neonatal cardiology program. We see anybody in the region who has got a high risk for fetal heart disease. The machines that we use have got to be really high quality machines because we push them to their limits. We've got the machine you saw me using, which is 7.5 years old, which is quite elderly for an ultrasound system. One of the reasons that we would like to get a newer system is to try and increase our capacity for the early fetal echo patients. At the moment, we're always operating at maximum capacity at our clinic. We're always trying to squash in extra patients that need to be seen. And if you're waiting for a scan for your baby because you're worried that there's a heart problem, that is an incredibly anxious time, and it's awful for us to leave women waiting, and we feel that terrible pressure to get through the list to try and get everyone seen, but also spend the time that they need. So having another system would enable us to jump in, get women through quicker, reduce the waiting times, allow us to have as much time as we need for those patients that need more time. My message to the donors is that we're incredibly grateful for your help and that you're making a massive difference to the women that we care for. It really is an opportunity from the ground up to help a family with heart disease. This is often the first encounter that they have with the Stollery cardiac program, and so it's exceedingly meaningful, the input and support that you could give us hopefully for this machine.